I am Yanir Bar-Yam, one of the founders of the World Health Network. Today we have with us Dr. Kavita Patel, a practicing physician who is Director of Policy for the Office of Intergovernmental Affairs and Public Engagement in the White House in 2009 and 10. Kavita, it's great to have you here.
Thank you so much, Yanir, for having me.
Patients are still suffering from COVID, with more and more having long COVID, and long COVID symptoms are not going away. What are you seeing, and what can we tell family and friends to motivate them to stay safe?
Yeah, thanks for asking this question. And for context, I'm a primary care physician trained in adult medicine, so internal medicine. So I primarily only see adults. But what we are seeing is very interesting because many patients are coming with no diagnosis of long COVID, or technically the term we use is post acute sequelae of COVID, PASC. That's actually kind of the designated clinical diagnosis for long COVID for short. Most people come in with what I'll say are kind of vague symptoms, some with cardiac symptoms. They have heart palpitations or abnormal heart rhythms, all the way to pretty dramatic presentations, brain fog, trying to think, just having problems kind of conducting their daily work as they had previously conducted. But many of them do not come with a diagnosis in the past of COVID, interestingly enough. And I think this is the product of the fact that we had so many at home tests or tests that were available for people to check for COVID in the comfort of their homes, which was the right thing to do. But then those diagnoses don't necessarily translate to their medical record. So often what we see are symptoms. And we have, I mean, depending on the studies you look at, Yanir, we see prevalence of long COVID anywhere as high as 1 in 3 adults. I would say that for my practice, it's averaging to be, when we kind of explore and look into it further, in my visits, it's about 1 in 8, 1 in 10. And that, I think, is just a reflection of the fact that many people come in for other things and you really have to probe. I bet that if we looked into some of the other cases, we would find long COVID or post acute sequelae of COVID. But most people don't come with that diagnosis and presentation. They come with other things. One of the more interesting recent cases I've had was a woman, 42 years old, with hair loss and skin changes. And because she was 42, I think many people thought, including myself, that potentially it was early menopause. And it's only in talking to them and asking about whether or not there had been a history of COVID infections. And unfortunately, again, because of the lack of biomarkers, testing to kind of tie long COVID to a specific time and place when they had had COVID in the past, we don't really have the tools to make that diagnosis kind of clean. So what we have to use is what I call a diagnosis of exclusion, meaning we can't just assume something is long COVID. We have to rule out many other causes, which often take many visits, and depending on the type of insurance you have in the United States, can cost thousands of dollars. And so those are very real barriers, I think, to making the accurate diagnosis.
So, this is what you're seeing, lots of long COVID, unfortunate. How can we communicate about this to others so that they are protecting themselves from getting into this state?
Yeah, I mean, I think again, the most basic protection is protection from infection. So it's all the very basic things for years that we've been talking about. It's important to both, when you're in not just crowded settings, but even if you're in kind of smaller gatherings, that you be vigilant and mindful if people around you seem sick. And I mean, visibly coughing, or someone says to you in the workplace, Yanir, I've had this cold for a while. It's very helpful to just make sure that, one, you're testing, people around you are testing. Rapid antigen tests are still available, and in the United States, still also provided free of charge up to a certain limit. So I think there's important testing, taking your own precautions. Masks are not perfect, but they're certainly an incredible barrier, especially in crowded situations, planes, trains, automobiles, subway, workplace, schools. And then on top of that, I think, there's a huge amount of misinformation about the role of vaccines. I just want to say the role of vaccines, especially with long COVID, the evidence base has now been building that vaccines can be helpful along with treatments for COVID, such as Paxlovid, along with a trial recently that showed that a very common drug that we use for treating diabetes called metformin can also be helpful. So if you don't have COVID and you've never had COVID, you're part of a very small population, but taking precautions to not get COVID will be your first line of defense. Even if you've had COVID in the past, when we see people with long COVID, oftentimes they've had multiple COVID infections over time. So just because you've had it once or twice doesn't mean that you can't get infected again. So protecting yourself even in those situations. And then third, if you do get diagnosed with COVID, getting treated and talking to your physician about treatment options, which again include oral medication. There are still some role for some people with IV therapies. So there's some things that we can do even if you are infected to help to decrease the probability or possibility of long COVID. And then if you have long COVID or you suspect that you do, my best advice is that you get yourself to a doctor or a clinic or health system slash hospital that has experience with long COVID. We are seeing long wait times in long COVID clinics in many parts of the country, but as more doctors learn about long COVID, many of us are getting trained in that. So getting yourself diagnosed by a group that has seen your symptoms, your patterns will also be very helpful.
Great. Thank you, Kavita, very much. Please, if you want more information, please go to whn.global. And there is also an opportunity to sign up and join the World Health Network's efforts in combating the pandemic and other public health challenges. Thank you very much.
Thank you.